Once you have relieved the impaction, what do you do next?
Okay. The next thing to determine is whether or not the child is having actual fear with defecation, and that's called Dyschezia. It's very common for parents to come in and tell me that their child will go into the side of the room and push for hours before the stool comes out. And what's required is for them to get the understanding that what their child is actually doing is pushing to hold the stool back. They are straining, and why does the child do this is because the child has repeatedly passed large, hard, painful bowel movements that hurt. Oftentimes there's blood associated with it, and the child wants to avoid it. Unfortunately, the child, by doing that, lets the stool stay in his or her body longer. The stool dries out, it gets harder, and it becomes even more difficult and more painful to ultimately pass. For those child, the very first part of the process after getting disimpaction, because all of those children by definition virtually are impacted, is to create a method which is pharmacologically to allow them to go for several months without having any pain with bowel movements. This way they lose their fear of having bowel movements, and then they can begin the remainder of the protocol. In my experience, it will usually take months, not days and not weeks, and usually the average is 3 months before the child is ready to be going to the potty and having a bowel movement on his or her own, because that's really how long it takes for them to forget about the constant fear related to the pain associated with the bowel movement. So during that period of time, it's very important that the parent administers, and I'll usually use either Senokot, 1 teaspoon twice a day, or Miralax, and it will be based on the child's weight, and we'll have a little graphic on the website to help you to do that, on a daily basis. And when the child is ready, we'll get to that in a moment, you'll very, very slowly and gradually lower the dose of the medication, because you want to make certain, again, that the child does not wind up in a situation where they start having firm bowel movements and pain and go back to that same vicious cycle of holding back the stool.